being able to catch these things in the beginning is much easier to deal with than when they were at the end. What if I told you that your blood pressure, your blood sugar, and your weight aren't separate problems? And more importantly, those numbers alone spell the risk of a crisis that is going to blindside a lot of people. And unfortunately, the numbers aren't talking about it. I'm Dr. Barry Pierre. I'm board certified internist, host of Medicine Mondays. And I'm here to talk to you today about why it's so important to know your numbers to avoid the crisis that's ready to come. All right, so by the end of today's episode, I'm hoping that you're going to be able to, one, recognize, hey, what are some early signs and symptoms and numbers I should be looking for my personal health and well-being, more importantly, my family's? How do I push it back against a system, unfortunately, this medical system that I'm in? How do I push it back against this system that wants to, again, brush aside the numbers until it's too late? So I'm hoping that by the end of this episode, you get those two, right? So let's talk a little bit about it. Let's start talking about what is cardiometabolic syndrome. Like, you may have seen it. It may have came across your screen, long word. You're like, all right, what is, sounds like a whole bunch of words put together. Like, what am I talking about here? Conditions like blood pressure, diabetes, cholesterol, and obesity, when they like meet in the middle, almost like a crossroads, when they meet in the middle, this is the encompassing aspect of a cardiometabolic syndrome. And for us, especially as healthcare providers, we tend to look at these factors and we kind of put you in buckets. I say all the time, when we have patients, we put patients in different buckets. You go to the emergency room, it's a very, very sick bucket, kind of sick bucket, a little bit of sick bucket. All right, we can kind of triage and let them wait, right? Same thing in medicine, right? When we look at different signs and symptoms and factors in regard to our patient, even though, yes, we want every patient is individual, we understand that, like, hey, you know what? If they're in the bucket here where they're obese, they have hypertension, they have diabetes, they have high cholesterol, that is going to increase their risk for a lot of downwind effects that I need to try to prevent. Like what, Dr. Pierre? Like strokes, like heart attacks, like kidney failure, like amputations, like blindness, all of these things that are downwind effects, but they all start with these numbers here that a lot of us will ignore, not give it the level of credence that it needs to give until today, right? So I want to talk about this, right? This is something, right? And y'all know right now, me and the CDC are beefing because of who's in charge right now. Y'all know me and CDC are beefing. But when numbers come out, right, you have to kind of acknowledge it. According to CDC, the number of adults with both obesity and diabetes has doubled in the past decades. I want y'all to think about that. The number of adults who are obese and diabetic have doubled in the past decade. And if you think about, hey, what are the downwind effects that Dr. Pierre is trying to control? And when we talk about hypertension, when we talk about diabetes, when we talk about cholesterol, it's because he's trying to prevent us from getting a stroke or heart attack, needing dialysis. So if the number on this side has doubled, what do you think the number on the other side happened? I want y'all to think about it. If the front end number, right, y'all know, understand, right, for my business folks, if the front end number has increased, the back end number is going to increase as well, right? So it's so important to understand that when we have these checkups, right, these checkups that go 10, 15, 20 minutes, however long your checkup is, your doctor is trying to get a lot of information out of that 10 to 15 minutes, was what we're trained for, but they're trying to pull out a lot of information because they know if I don't do what I need to do right now in this 10 to 15 minutes, there may be some trouble down the wind that I need to try to avoid. I say all the time, like, being able to catch these things in the beginning is much easier to deal with than when they were at the end. I've had patients, again, I've talked about this, especially when I do outpatient medicine, inpatient medicine. I've had patients where I know for a fact, if I could have just got you this one pill that probably costs $4 a month, or sometimes some of these pharmacies will give it to you free, depending if you buy some milk or get a flu shot, right? I know if I can just get this one little medication right now, I don't have to worry about taking care of you when you get a heart attack. Like, I just know it. There are people who have gotten heart attacks because they didn't have their blood pressure medication. There are people who've had strokes because they didn't get their diabetes medications, right? People who have had to get amputation because their cholesterol is so out of whack that their plaque disease is so built up that they have terrible blood flow, right? Like these are just, again, cause and effect, cause and effect. And this is a crisis that I don't think people are really putting together. Like a lot of times, and I do it all the time, where I'll have an episode talking about diabetes. I have an episode talking about hypertension. I'll have an episode talking about cholesterol, an episode talking about obesity. But those aren't separate issues, y'all. Like now we're getting to the point where these are like forming like the Avengers. They're forming like the Avengers. And if we don't do what we need to do now, because clearly we haven't done in the past decade because the number has doubled. If we don't do what we need to do now, we are going to be in a world of trouble. We're going to be in for a world of trouble and a world of hurt. So that's what I'm hoping that we can kind of get to today, right? So what can we do, right? What can we do to try to fix the system at hand to make it so that we have a much more better fight against all of these downhill issues that like we can kind of see coming. So remember, when I think about, again, as a resident, and I think about those first couple of patients I would take care of, and they had a stroke, they had a heart attack, and you just hear the history, because history is everything. You just get the history, and you're like, why didn't they just tell you to do your blood pressure? Why didn't you get the education? It's part of the reason why I do what I do now, right? Is because I recognize that, man, like if you can have a Dr. Pierre who gets on your YouTube page or your podcast or whatever clip you may be seeing this from, if you could have a Dr. Pierre who just puts a little bit of fire into you to say, you know what, I do need to take my blood pressure medication today. I do need to take my diabetes medication today. I do need to watch my diet. I do need to exercise more. Like you'll be in for a world of wonders, right? So make sure we understand that, right? So before we talk about some actionable strategies, right? One thing I like to do, right? I like us to tell us the truth, right? Y'all know here on, the especially my YouTubers, right? Y'all know here on this channel and the Launch Learn community, we love to tell the truth, right? We're about truth telling here. And we have to understand that, yes, it's not just about family history. It's not about the environmental risk. It's a lot of things, right? It's a combination of things. And these are just big drivers for the downhill issues that if we don't, again, y'all, if we do not, get this in the bud, right? It's trouble, right? So before we get to the actionable tips, make sure if you have not had a chance, make sure you hit that subscribe button, hit the notification bell button, so you are always going to be aware of what's going on in the world of Dr. Barry. Make sure you join our newsletter as well. Link is in our show notes in our bio. So let's get to the work. Let's get to the work, because the work is what separates us. The work is what helps us so that when we look in a decade in advance, right, that one, we're still here 10 years from now, and two, that we're not a part of that statistic that has us doubled in obesity and hypertension, doubled in obesity and high cholesterol, doubled in obesity and diabetes, right? Like we want to make sure that we're not a part of that statistic. And if you want to do that, let's follow some steps, right? So I say this all the time. Number one, you got to know your numbers. More importantly, know your patterns, right? And when we say, Dr. Pierre, what does it mean, know my numbers, right? We got to know what our blood sugars are. We got to know what our blood pressure is. We got to know, hey, get most of us, try on clothes and buy new clothes. You should know what your waist size is, right? Because there's a calculation that we can kind of put in together. And then your cholesterol panel, right? So you got to know your numbers, right? And you can't know your numbers, guess what, if you're not actually getting checkups, right? So again, you see, there's multiple ways for me to tell you to get your checkup without telling me to get your checkup, right? So if I say, hey, you got to know your numbers, you may be saying, hey, Dr. Pierre, how can I get my numbers? Go get your annual physical, right? Go get your annual physical if you have not done so already. So know your numbers and keep records on your own. Yes, I know your doctor has this an amazing electronic medical records that they can pull up from their phone or from the sky or from space. I understand that. You need to know your numbers. You should have that written down, or more importantly, say, hey, doc, can I get a copy of my labs for my own? Your doctor will give it to you. In fact, your doctor will be happy that you asked for it, because it's not something that you're just doing like, oh, thank you for giving my numbers. No, like, can I get a copy of those numbers so I can have in my own journal? Know your numbers. Number two, right, you got to ask some good questions. A lot of y'all, it's not like y'all don't want to ask good questions, you don't know what questions to ask. So number one, how do these risks, right? How do my numbers, if they were combined, what product, where category I am in the risk stratosphere, right? And does this increase my risk for long-term issues in the past, right? So whether I'm diabetic, hypertensive, high cholesterol, if I'm obese, if I'm not exercising, if I'm a smoker, if you combine these risk factors, doc, like, is this good for me or bad for me, right? Like what level? And your doctor can give you a good, criteria to say, hey, you know what? If we don't do something about this diabetes, if we don't do something about this cholesterol, right, these are the problems at hand, right? So always ask your doctor, like, hey, what are these numbers telling me for the now, and more importantly for the future? Always make sure you do that, right? And then I like to say, right, y'all know this is, it was the month of March. We're about to get into at least when I'm recording this, the month of March, we're about to get into April, right? Second quarter of the year, right? And a lot of y'all, I know y'all don't want to hear this. A lot of y'all made some New Year's resolutions that y'all not following anymore. Again, I know, guys, trust me, I understand. Put it in the comments if you're one of those people who are still following your New Year's resolution. Also, put in the comments if you're one of those people who kind of like, you got me, right? So if you're, especially my YouTubers, put it in the comments if you are still on your New Year's resolutions. But you got to start shifting, right? And I'm not saying big shift like, all right, like now go eat once a day, right? Because that's not viable for a lot of y'all. Or go exercise 10 times a week, right? Not viable for a lot of y'all, right? But we got to start small, right? This is when you start small, whether it's walking, 5-minute walks, whether it's, hey, I'm going to add a vegetable to my dinner from now on, because it used to just be a whole bunch of meat and fat. I'm going to add at least one vegetable. I'm going to decrease my calorie intake. I'm going to check my sugars more. I'm going to make sure that I don't walk in that pharmacy and not know what my blood pressure is looking like. I'm going to do just a small thing. I just want you to start doing some small things now, right? Because they're going to build by the time December comes around. And I'm going to ask you about it as well, right? They are going to build by the time December comes around, right? And this is the big one, right? When we think about, especially in healthcare, understanding that this is a team approach. So your doctor recognizes you can't do it on your own. So don't be afraid to ask your doctor for help and direction in these things, right? A lot of times you guys have insurance plans that will cover, like, a nutritionist appointment, a dietitian. Like a lot of times you guys will have insurance plans that will cover some of these things that you aren't taking advantage of, and your insurance company loves you for it because then they don't have to pay as much. So understand, again, if these are some things, right? Number one, right, know your numbers. Number two, right, ask the right questions. I already gave you the questions. Number three, start changing some of those little habits. Start changing some of those little habits. Start small, get big by the end of December come around. And then number four, again, make sure you implore your doctor, your healthcare provider, like, hey, this is a team game. I need some support, and figure out, hey, what are some things I can do, whether it be some screenings, whether it be some videos, whether it be some referrals. What can you help me, doc, to help me get to the point where that in 10 years, I'm still alive and kicking and looking good while doing it, right? So y'all know I get to the part of this episode, right, where y'all know I got to talk about some of these myths that are out there. I gotta talk to you, because again, I'm on the internet just like y'all. I'm online just like y'all. A lot of it, and of course, a lot of it, obviously I'm doing education, but a lot of it I'm doing kind of research, right? Because I need to know what my patients may be hearing or seeing, so I can be ready to like supplement that or like combat it, right? So number one, right, don't fall for these quick supplements, detox teas. All these things are just magical things that are going to help you, right? I'm gonna talk about peptides in a different episode, because I'm getting a lot more questions about peptides. So we're gonna, trust me, that's coming. But again, understand that a lot of these things that you see online on TikTok, on Twitter, and on Facebook, a lot of these are just more get rich quick schemes for those who are a part of it. Right. So they understand, like, hey, I give you this detox tea that's more of a big diuretic, and you go to the bathroom a lot. You say you lost a lot of weight. No, you're just like really dehydrated right now. All right. Or like, I'm getting you this magical supplements that the healthcare industry doesn't want you to know. Anytime you see something that states, hey, this is what your doctor didn't want you to know, I can assure you we want you to know it. Right. So so the next time you see a headline, hey, the doctor didn't want you to know this, the system didn't want you to know this. No, Dr. Pierre wants y'all to know that. That's why Dr. Pierre comes and tells y'all, hey, did you know? Like we want y'all to know it, right? We don't want to keep it secret, right? And this is for big one, especially my little type A folks, right? do not let perfectionism freeze you from making some of these changes, right? A lot of y'all want to make sure that the whole environment is all ready to go before you're ready to take some action. Don't do that. It's go time. It's work time, right? You do not have to wait till the stars align and the moon's in lunar phase or whatever phase it typically is. Again, shout out to my moon lunar folks, right? Or cycle. I don't know what y'all call it, but shout out to y'all. But it does not have to be super aligned for y'all to get to work, get to action, ask your doctor the right questions, know your numbers. I don't want y'all to, don't do that, right? Y'all know better. Don't do that, right? So let's kind of do a quick little whoop. Let's kind of tie this bow up to this episode here, right? So again, right, the crisis no one wants to talk about, right, is the fact that, right, that the obesity, diabetes, hypertension, high cholesterol are forming like a Voltron right now, right? Like they're forming like the Avengers, right? Like it's gonna be a problem if we don't take care of what we need to take care of. How do we take care of it? Right? Know your numbers, talk to your doctor, ask the right questions, and get the team approach, right? Accountability is everything for the year 2026. Get the team approach, right? So understand that it's not just one thing that's going to be a problem. It's the combination of things that are going to be a problem, right? And again, and they may just look like little bitty numbers now, right? They may just like, it's just cholesterol. I don't notice a difference. It's just high blood pressure. I don't notice a difference. It's just my sugar's a little high. I don't notice a difference, right? They may seem like nothing now until you get to my side of town, where instead of me talking about hypertension and diabetes, I'm talking about strokes, and I'm talking about cancer, and I'm talking about heart attacks, and I'm talking about amputations and dialysis. We don't want to have these conversations with y'all. I assure you, the healthcare system is not trying to hide the fact that we do not want to talk to you. We want to try to prevent it. Right. My goal is always, how can I make, the hospitals broke? That's always a goal. As a primary care doctor, how can I make the hospitals broke? And I do that by focusing on preventative and manageable care early in the beginning to get it to the point where you don't need a hospital unless it's first like some elective knee surgery because you got arthritis, right? Neither here or there, right? So again, I'm yours truly, Dr. Perry Pierre. You guys be blessed. Have a great evening, and I'll see you next week.